My brother died from this disease, but I'm recovering like you, and we're all gonna make it.
Treatment works! Treatment works! Treatment works! Treatment works!
We are tired of burying people. We should be treating people. I look at how many hundred of you here today as partners in our raising consciousness and advancing action to focus on the devastating problem of addiction. Addictions are tearing families apart. They are disrupting the workplace and undermining attendance and productivity. Addiction is endangering and terrorizing our children. Every one of us needs to be an activist in getting treatment for the people that need help because of the addiction crisis.
And my teenage son got very involved in drugs and brought the family to a crisis, and I started seeking real answers and solutions.
The primary event for today starts at 1 o'clock, and that's the State House rally. We have dignitaries that will be there. I know the governor's office has been invited. J.P. Mealy, who's the chairman of the Governor's Council on Alcoholism and Drug Abuse, will moderate that. We'll have some senators, some assembly representatives there. So when we're at the State House steps and collectively we've come together, we have some signs. At that point, let's not be afraid to make ourselves not only seen but heard.
Education is the key. No one's really talking about prevention, treatment, or addiction.
There should be way more treatment than there is.
In treatment, you get education, job skills, you get, real concern from your peers and staff, and in jail you don't get any of that.
And now one of the big problems is that half the people of the adults and more of the adolescents can't get treatment.
I came out today to support the people because I'm a recovering addict myself. And I just want to give back.
This thing right here today is really important.
Besides being a recovering person, I'm a mother, I'm a wife, I'm a small business owner, and I am passionate about recovery because I've been given a second shot at life.
People in recovery like me have to come out of the shadows and stop being ashamed and talk about their recovery and learn how to do that appropriately that's comfortable for them, and talk about their recovery so that the public doesn't just see the horrible face of the addicted, but they begin to see the face of people in recovery who are doing well.
Got married, had a son, got a job, pays taxes, owns a house, and is now the county executive of Mercer County. I'm in recovery, and I'm proud to be in recovery.
We have to keep coming back and getting after these legislators, and I may be doing it in the halls of Congress in Washington, D.C., and you guys are here doing it in Trenton, and we are doing it across the country. There is a growing movement of recovering people who are out there saying, hey, we are in recovery, and we are going to fight for our rights in this country.
In my work in advocacy, that's been my greatest frustration is how do you motivate, how do you engage people? I've never had to be convinced that there are decision makers making decisions that affect citizens in New Jersey, and that as a citizen I have a right to engage those decision makers and inform them of how I believe those decisions should go.
Some constituents believe that somehow it's difficult to get in touch with us. My home phone number is listed in the phone book. My office is right on a major road in my hometown across from the local diner. We're here in Trenton. We are very receptive. I think all of my colleagues in the legislature would love to hear from our constituents, would love to see our constituents come down here to the State House, visit with us in our district.
The leaders were encouraging us to talk to the legislators. It's a bit intimidating at first. There are these people here who have been elected. He was very warm, he was very personable.
I think continuing the dialogue with the legislator is important. Continuing to write letters and emails, building that kind of personal relationship that makes a connection between an important public policy issue and the people it truly affects on a day-to-day basis.
I wanted to encourage him to support the bills that favor recovery, prevention also, especially with our youth. There are a number of bills now.
When a constituent brings a real life message, how an issue such as this affects them and has affected their daily lives for years in some people's cases, that's very personal. You talk about it to your colleagues here in the Assembly. You talk about it to people in committee hearings. When issues of budget and health care and the healthcare coverage and insurance coverage come up, it's not just a document you're reading or another testimony from another expert. It's a real life person who lives around the corner from me and how it's affected them. So it fundamentally alters to the benefit of our view of these public policy issues.
I've had members of Congress say, when I've told them that I am a person who has had alcohol and drug problems, that I'm in recovery, they've told me to stop talking about that addiction issues are losers, that they can't help me on those issues, that addicts don't vote, that addicts are not organized politically. It's a loser issue. There is definitely stigma and discrimination is alive and well, and when I encounter it, I try to use it as a reason to keep going and doing this work.
A lot of times social change and change in attitude starts with a legal process, and then people follow suit.
We have a huge community out there of people in a holistic sense, that right down from the person that's in this addiction to the family unit. And in a country of our size, the power is in the legislation, that we have to get the people to realize that it's not just treatment facilities, it's not just 12 steps, it's right down to every individual, into every family that needs help. And we have to, as a community, be willing to do that.
And continue to reach out to legislators. It can't be a one-day advocacy day. It can't be one letter. Not only write your legislators, but also write each other, communicate with each other, because one person is effective, 100 people are even more effective. 100 constituents of mine on any given topic talking to me gives me real life stories. Advocacy Day needs to be advocacy year after year after year.
Contact your legislators, your assemblymen, your senators.
Recovery is the key! Recovery is the key!
I want to make sure that you keep persevering, that you keep coming back, because you know what? This isn't easy work. This is not easy work. Those of you who have been in to see your legislators, my hats go off to you. Keep up the good work, keep up the fight, and keep coming back. Thank you.